योजना एवं वरिष्ठ इंटरवेंशनल कार्डियोलॉजिस्ट अपोलो अस्पताल नई दिल्ली का अभिनंदन करें। पौधे और आयुर्वेद किट के माध्यम से भावनाओं का ससम्मान आदान प्रदान। बहुत बहुत धन्यवाद। पुण्य सती का स्वागत। और राइजिंग राजस्थान हेल्थ ब्रीज समिट, हम सभी जानते हैं कि स्वास्थ्य के क्षेत्र में दिशा दृष्टि और दूरदर्शिता को रेखांकित करता है ये महत्वपूर्ण दिवस। और अब हम आग्रह करेंगे प्रोफेसर डॉक्टर विवेक गुप्ता जी, उनसे कृपया आप आए। उससे पहले आपके लिए चाहेंगे आप सभी की तालियों की अनुकोच। आप चेयरमैन हैं इंडो यूरोपियन सुपर स्पेशलिटी हॉस्पिटल प्रोजेक्ट्स, सीनियर इंटरवेंशनल कार्डियोलॉजिस्ट अपोलो हॉस्पिटल न्यू दिल्ली। और आज के इस समारोह में आप पब्लिक प्राइवेट पार्टनरशिप इन द मेडिकल एजुकेशन एंड सुपर स्पेशलिस्ट केयर अपॉर्चुनिटी इन राजस्थान। Ladies and gentlemen, please join me in welcoming. It's time now to hear Professor Dr. Vivek Gupta. Please welcome Professor Dr. Vivek Gupta, who has performed thousands of simple and complex angioplasties and played a crucial role in saving thousands of lives. Dr. Gupta, please.
Hello. It has been my great pleasure, and actually I am very thankful to the government of Rajasthan to give me this special opportunity to tell you something about healthcare. I've been practicing cardiologist in Delhi Apollo Hospital, but we have an ambition to develop some new initiatives in the form of Indo-European. I was working in France before. So we requested the Honorable CM and of course the government that we want to develop this new initiative, and that's why I am here to give you another 10-15 minutes of interesting talk about this. So Honorable Health Minister, Government of Rajasthan, and dignitaries on the dais. So I really thank you for listening me for this program. So Rajasthan medical healthcare, this is Indian and European healthcare. So this is my topic, although PPP will be covering public-private partnership. As I told you, I've been practicing for the last 25 years. My plan of presentation would be my planning, Indo-European Advisory Board, then medical education and health system in Europe and USA, medical education healthcare in Indian context, medical education, healthcare Rajasthan, role of public-private partnership, healthcare delivery in corporate hospitals, need of improvisation on state healthcare and medical education, steps needed for improvisation or joint venture in Rajasthan, Indo-European course on healthcare for primary care physicians, plan for the various states. These are small plan presentation. So as I told you, I have been working here in Delhi Apollo. We have been doing angioplasties here. And my special interest and passion is life-saving angioplasties, which we have been doing, and along with other interventional cardiologists. I have worked in France before, and therefore I have some idea about the European model versus Indian model. And of course, I came back in 1998, and this is the MOU we are going to sign for the Indo-European Medical Universities and multi-specialty hospitals. European model of college and hospital with support from European high-tech professional doctors. This is our aim and this is our USP. European model of college and hospital with support from the European high-tech professional doctors. Medical education of European standard equivalent or better than any PGIs. The education should be at par with better than PGIs. Healthcare provision better at par with best of the corporate hospital. So we have a planning of combination of the best of the medical education and the best of the healthcare, which is unfortunately not so well developed in many of the private medical colleges in India. So we have this ambition. We have planning for Jaipur, Neemrana, and with the land from the government. We have a huge USP. Our USP is European Advisory Board, and Professor Alan Premier with the General Blessing Lester, Dr. Elena China from France, from Dr. Patrick Serrat from Netherlands, from Francisco Romeo, from Italy, Dr. Silva from Germany, Italian, Carlo Di Mario, Helder Pereira, Therese Levin, Max Sebastian, Martin Ulrich Segwert, who was the first person to do stenting in 1987. Although he's retired from the active role, but he's still there with in our program as an advisory board member from Australia. So to not go into detail about the project, I will go directly about the healthcare system. India, global healthcare infrastructure system, India versus physicians per population. So the data are available, but I am not not going to do the details about this thing. So global health infrastructure, India 1.5 beds per population, 1.2 physicians per 1,000 and nurses per 0.9. This data is little old, something like 5 years old. But the data will be available, that is not so important. High standard of medical faculty, teachers, 7 years of continuous direct training with MBA equivalent degree, this is what you finance. The European model and Indian model, the education system is not very much different, but healthcare is of course different. Duration is of course 7 years, 6 years there, we have 5.5 years admission processing, entrance exam, we have NEET, PG, postgraduate pathways, similar, almost doctor-patient ratio, generally high doctor-patient ratio but varies by the country, low doctor-patient ratio, especially in the private setup. Doctor-patient ratio, generally high doctor-patient ratio but varies by the country, as I told you, but in our setup, especially in the private setup, we have some difficulties in getting many patients in the hospitals. Healthcare system model India versus Europe. This is very important. We have predominantly public funded systems in Europe and mostly universal coverage. This is very important. All the patients of France or Europe, they are covered by the healthcare system either by the government or private, mostly government. If you are a resident of France, I lived in France, if you are just a resident of France, you show your ID and you will be treated completely free, and those public hospitals are very well developed. So we have to do, we are learning and we are developing, and we will be developed as our mission of Honorable Prime Minister Mr. Modi ji, that we will be developed very soon in the country, and then we'll have a similar standard of quality of infrastructure, waiting time, technological advancement, medical insurance coverage, focus on preventive care, public health campaigns. So these are the benchmark for us, and we will be doing very soon. Medical education, healthcare in Indian context. India is a large country with 1.4 billion population. We have a political, economic context, organization structure, delivery mechanism, health financing mechanism, coverage patterns, current state of health and healthcare. So I have to skip few slides in the interest of time. The Indian healthcare market is huge. 5.2% of GDP is being spent. Healthcare is the largest service industry in terms of revenues and second largest after education in terms of employment. Investment of India, investment needs to be in healthcare sector are comparable to other infrastructure sectors. And this is the slicing of the healthcare pie. This is how the distribution of the financial part goes. I just want to highlight the training part is only 1%. So we have to increase the training component budget for the healthcare, because training is most important. The doctors have to be trained, the nurses have to be trained, and therefore then only the primary health centers and secondary health centers, community health centers will do better or almost equal to district hospital. India is now the second fastest major economy in the world, largest in this. Healthcare spending in India is expected to rise by 50% per annum. We need to have privatization, shift from the socialized to private providers, booming economy, high literacy rates, shift to lifestyle-related diseases, easier financing system. Government expenditure on healthcare has been on the decline in relative terms and currently 0.9% of the total GDP. We have to increase this, although Honorable Modi's government has slightly increased the overall expenditure on the healthcare. Lifestyle-related diseases, increase the healthcare spending, increase in life expectancy, which cyclically further derives increase in healthcare spending. So I will go directly. There are few gaps. The gaps analysis, we all know, the government knows it, so not going into details, but we have to have better healthcare privatization opportunity. Areas of opportunity for the medical is the medical value travel, clinical trials, of course, telemedicine and the medical tourism. Telemedicine is a very important. Telemedicine today has given the capacity of the ordinary doctors to do extraordinary things, and this was really realized more during the COVID time. So modernization of healthcare requires telemedicine, total health requires nutrition centers, eye screening, IUs, geriatric centers, satellite clinic, water plants, rural sport, cancer screening, LCD training, women child survey, and skill training. That's most important part of the overall healthcare. Medical tourism is booming up. As you can see, that this is one cartoon where ambulances around the plane. That means the patients are coming all the world. India has advantage. India presents the first world treatment at the third world cost. The costing is a real advantage. Over 60,000 cardiac surgeries are done all over India per year, and we have huge medical tourism coming up, especially the private setup, and we have to control this. We have an NABH and then medical education system Rajasthan, coming on to very small touching upon what is the Rajasthan challenges. Post-graduation regarding medical education, there's some scarcity, especially in the public system. As compared to the UG seats have increased a lot, but PG seats have to increase. Financial constraints in the public institution. As usual, this is normal unless we increase the GDP. Variable quality of training in the rural colleges. Issues level to state policy implementation. Limited digital and technological integration. There are few challenges which have to be. Hospital services, India versus Rajasthan. In general, the healthcare access facilities vary widely with better access in urban areas, rural areas. access is limited, and similarly in Rajasthan also the rural access is limited, especially the hospital infrastructure. This is a report from 2022 Ministry of Health and Family Welfare National Family Health Plan Survey, and this is 19th Ayog report from 2022. Healthcare workforce shortage of doctors, nurses, especially in rural India, high vacancy rates in public sector hospitals. Similar issue with the particularly high deficit, especially doctors in rural areas. This is for Rajasthan. Patient to doctor ratio, national doctor patient ratio, this is 2022 survey. National doctor patient ratio is about 1 to 1400 population, below the WHO recommended of 1 to 1000. Rajasthan ratio is even slightly lower, especially in rural areas. So PPP, coming on to the topic which have been given to this, what is PPP? According to the Department of Medical, a partnership between a public sector entity, sponsoring authority, a private sector entity, a legal entity in which 51% or more of equities in the private partner for the creation of the management of infrastructure for public purposes for a specific period of time on commercial terms in which a private partner has been procured to a transparent and open deal. PPP project means a project based on contract or a contract or concession agreement with the government as statutory body. So to ensure that Rajasthan is transforming healthcare home to a large health delivery system with a large network of delivery centers, significant number of skilled medical resources, and increasing participation of private sector in tertiary care. This is a healthcare insurance system from Rajasthan. We are thankful to the government of Rajasthan, especially our new Chief Minister and the new Health Minister, that they will be further improvising upon whatever is existing in the PPP in healthcare. Government of Rajasthan recognizes the potential benefit of work in the private non-profit organization, has taken the lead in strengthening for liberal policy to enhance this. This very important slide, investment opportunity across Rajasthan, medical education, research, medical college, paramedical nursing. These are the opportunities for the investors in various hospitals, medical institutions, healthcare opportunities, manufacturing, pharma, etc. Recent PPP initiatives have been there, but I am not going to detail because the government knows it. And especially what are the new possibilities of PPP? Rajasthan has the largest number of teachers of primary, middle class, high school and college teachers from village to state level. These teachers should be given responsibility for the tutorial generation, the group to educate and monitor the program. Medical colleges, nursing and paramedical schools, public health training institutions could be extensively involved in organization camps. So what the PPP is general, it's a service contract, management contract, college contract, joint venture, and benefit from PPP as known. So coming on to the Chiranjeevi, I have just touched upon the very important part of the corporate systems. I just, because I work in Apollo, so I want to tell you that we have a high-tech systems, and most of the corporate hospitals are having the, not going to details about what we are doing, especially the liver transplant, bypass surgery, angioplasty. Ayushman Bharat has been the, I will just touch upon 1 second, rather 10 seconds for the Ayushman Bharat scheme, which is also being implemented, but Rajasthan government has given a further boost by giving some other yojana as well. So this was in 2018 when JP Nadda along with Honorable Prime Minister, there 1 billion money, the amount of money which was spent on this was 100 billion rupees. So it was a huge expenditure, but it has helped a lot of families from life-saving diseases, affordable burden, body health care. And this is the last 2 slides which I want to present about. You have to, what are the challenges for improvisation? You have to do improvisation. More number of hospitals and medical colleges, more implementation of PPP model, encouraging the private partners to implement the healthcare, subsidy by the government to the private, joint venture of the land with private partners for the medical college hospitals, uplifting of residential state hospitals, training, this very important part which is by touching training of the government doctors, very important for doctor. We have been doing an ICR, Indo-European course on healthcare primary. This is the last part, 30 seconds. I know the time is short. Indo-European course on healthcare for the primary care physician. This is my actually a real ambition. We started ICR program 2008, and we did in basically in Vigyam Bhavan, the first program. Then we did in London, Paris, Rome, Amsterdam, Zurich. So these are the few pictures of the program which we have done already, and we are doing. We have 20th program going on. Just last second. And the concluding part I have to do, and this was the Paris with the huge participation. The training of the government doctors has to be done because the doctor who's posted in primary healthcare is a pilot of the whole hospital. If you give equipment, if he does not know when to do ECG, how to read ECG, how to do intensive care, so the doctor posted in primary and community healthcare has to be trained to the level of private setup, and this will really boost the healthcare, I'm not in terms of economy, but services providing and reduce the mortality and data. So this was a new program which we did. We are coming up with a new program which will be done shortly. We have done more than 20 such programs, 20 ICR courses have been done, and this is next coming up in Port Blair. We are doing in Port Blair doctors and also doctors in Delhi. Thank you very much for the patient hearing, and I'm really thankful to Honorable Chief Minister and Honorable Health Minister for giving this opportunity for me to do something, to talk about something more important and relevant in terms of healthcare. Thank you very much.
podium.